Hello, my name is Dr. Nicole Holland Sims. I am supporting the Pennsylvania Department of Education around equity.
Hello, my name is Dr. Dana Milakovic. I am the Mental Health and Alcohol and Other Drug Specialist with the Office for Safe Schools in the Department of Education.
We're very excited that you are able to join us today. We are going to talk about staff and student wellness, a guide for creating equitable school systems, a roadmap for education leaders for the 2020 and 2021 school year. The mission of the Department of Education is to ensure that every learner has access to a world-class education system that academically prepares children and adults to succeed as productive citizens. Further, the department seeks to establish a culture that is committed to improving opportunities throughout the Commonwealth by ensuring that technical support, resources, and optimal learning environments are available for all students, whether children or adults. The Creating Equitable School Systems, a roadmap for educators, is broken down into the following categories. Establish a team, explore and select instructional delivery scenarios, support social and emotional wellness, focus on effective instruction, communicate with stakeholders, provide high-quality professional learning. Today's webinar will focus on supporting social and emotional wellness. Staff and student wellness will be an essential cornerstone of the reopening process and paramount to offering an equitable educational experience for all. The contents of the Staff and Student Wellness Guide is designed to highlight 5 elements that should be considered as part of the LEA and school-level action planning and are aligned to wellness communication, staff wellness, student wellness, and supplemental student services. The 5 elements are staff and student wellness communication plan, supporting staff in a tiered model, supporting students in a tiered model, enhancement of social and emotional wellness in a virtual environment, and alignment with supplemental student services. Focusing on psychological, emotional, and physical safety is one of the cornerstones of creating a safe, supportive school climate. Creating safe, equitable environments for students and staff will help mitigate the traumatic exposure experienced as a result of the pandemic. In addition, the roadmap offers resources to consider when determining methods of communication with stakeholders, that our universal practices are equitable, welcoming, and safe, and that conditions for monitoring and supporting identified staff and students that are demonstrating needs are addressed related to social, emotional, and psychological support. Some key terms and definitions that we'd like to highlight today start off with Pennsylvania's definition of equity. Every student has access to the educational resources and rigor they need at the right moment in their education across race, gender, ethnicity, language, disability, sexual orientation, family background, and/or family income.
It has been widely accepted and discussed throughout Pennsylvania and the nation that the current pandemic and racial unrest has resulted in exposure to trauma. It is important as we move forward in addressing staff and student wellness that we understand what the definition of trauma is, as well as the difference between trauma and trauma exposure. Pennsylvania's definition of trauma is based on the PA School Code of 1949, Act 18 Update of 2019, and has 3 components. Component 1 is exposure to an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or threatening. But exposure is only part of the picture. Events do not determine outcome. Think about how the people you know may have experienced this pandemic and racial unrest differently, how they have responded, and the responses are greatly different depending on their previous experience. It is important to remember that exposure to the event is not what determines trauma, but rather how the individual experiences that event. This is why components 2 and 3 are critical to understanding trauma. In order for trauma to have occurred, the impact of the event needs to be considered. A traumatic experience and response has occurred when the event has lasting adverse impacts and creates significant difficulty in cognitive functioning and physical, social, emotional, mental, or spiritual well-being. It is important to remember that while we recognize all citizens of the Commonwealth have been exposed to traumatic events, not everyone will experience trauma. The experience of trauma is dependent on how the individual experiences the events of the last few months and can be impacted by previous exposure to trauma, risk factors, availability of coping skills, resiliency factors, and availability and quality of social support. As local education agencies evaluate their current needs related to staff and student wellness, this roadmap offers resources to consider when determining the effective methods of communication with stakeholders, universal practices to address social and emotional needs, create safe, welcoming, and equitable learning environments, and conditions for monitoring and supporting identified staff and students demonstrating needs related to social, emotional, and psychological supports. As inequities are identified in educational systems, whether as a result of the pandemic or newly discovered through professional learning around equity and systematic oppression, the importance of ensuring psychological safety for staff and students in our educational communities cannot be understated. This guide has been designed to enhance and guide school planning around social and emotional wellness while aiding ease of utilization. The guide starts with a checklist and links to staff and student wellness checklists, a general wellness resource for reopening, staff and student wellness communication plans, social and emotional wellness support for staff, social and emotional wellness support for students, and alignment of supplemental student services. In the development of the roadmap, it is recognized and respected that LEAs are at different stages of planning and implementation related to social emotional learning, positive behavior interventions and supports, and multi-tiered systems of supports. This roadmap was designed to support staff and student wellness regardless of where you are in the planning or implementation phase of other initiatives. Key considerations, questions to consider, and resources have been presented to assist all entities with creating equitable, trauma-informed plans that address the emotional wellness and safety of their students, families, and staff. The beginning of this plan starts with checklist for staff and student wellness. Developing a staff and wellness communication plan involves communicating and planning with a wide range of stakeholders and ensuring understanding that prioritization of staff and student wellness is a focus. The beginning of the document was designed to be a complete checklist for you to determine as a school entity where you need support and what resources you already have available. In reviewing the checklist, the areas are linked to other areas in the document and will be explored further during this webinar. Developing a family engagement plan that includes informing parents of updated expectations for students returning to a traditional school setting, a virtual education setting, a hybrid approach, and/or utilizing transportation systems as applicable supports family engagement and a feeling of trust in the school environment. Developing a communication plan with staff that includes transparent, frequent updates, and communication should be planned in a manner that promotes feelings that your staff is up to date on decision-making and planning and allows them to be aware of upcoming communication with families. Identifying and reviewing processes for students, families, and staff to access health and wellness support systems, including the mental health professionals available in your school setting, your mental health family resource center, your school nurse, your student assistance program, and your homeless liaisons. Creating school and district-based information sheets to advise personnel of guidelines, reopening procedures, and associated health and wellness protocols helps reduce the potential misinformation from unofficial sources and ensure consistent messaging throughout your district. Consult with mental health professionals to determine availability of self-care supports for staff and develop daily check-in procedures to communicate well-being and identify additional resources that are available. Additional resources will include community-based services and services available through other agencies. And then finally, creating a plan with a focus on wellness and communicating that plan to all stakeholders. Thoughtful planning for the social and emotional wellness and support of staff is vital to the success of any school year, but in particular, the reopening of schools following the last few unprecedented months and the remainder of the 2020-2021 school year. Deliberate planning that addresses staff wellness and enhances staff's ability to engage in productive practices to benefit the system, the family, and your student well-being. Anchoring this plan in the values of collaboration, mutuality, cultural sensitivity, and empowerment enhances the overall climate of the school entity. Aligning supplemental student services helps ensure that we are focusing on the needs of all of our students, especially our students who may be most vulnerable. Identifying the supplemental programs that are already present at the school and facilitating communication with the programs and the school entities administrators. Identifying key contact personnel for each supplemental program helps ensure that the needs of the family are considered and that additional supports are available. Identifying existing school teams that can coordinate with after-school programming can enhance the social emotional learning of students enrolled in the after-school program. And ensuring coordinators of supplemental programs, they also receive the information parents are receiving, facilitates communication and family engagement.
Next, we will talk about staff and student communication plans. Developing a communication plan that is rooted in transparency, collaboration, and voice can help develop a team focus for schools and improve family, staff, and community engagement. In the bullets above, you will see all of the various forms of engagement that could be approached. Multiple languages and multiple formats. Here are some additional key considerations when considering your communication plan. Determine how you will plan for and communicate a focus on wellness throughout the reopening and during the school year. These considerations would include publicizing what makes the coming year special and communicate often and with optimism about the back-to-school plan and return to school. Plan several kickoff or welcoming events that comply with safety and health guidelines from the Pennsylvania Department for Public Health and the U.S. Centers for Disease Control and Prevention. Continue to celebrate successes as the year progresses. Plan welcoming events for teachers and staff, families, students, and community members. This includes volunteers, which are meant to be celebratory and relationship building.
The events of 2020 have been unprecedented in the way in which schools, families, communities, and students have experienced potentially traumatic events. When natural disasters occur, they will typically affect only one area, and resources from unaffected areas of the state or surrounding states can be utilized to support those affected. However, this is an event that has affected everyone in today's society. It is important to realize as we start the new school year that we are requiring our staff, many of who have been individually affected by the pandemic and civil unrest, to put aside their emotions and fears and focus on the needs of students. While this is a task they readily take on as caregivers in the school setting, supporting staff wellness will be even more important in this school year than it has been in the past. Deliberate planning that addresses staff wellness and enhances staff's ability to engage in productive practices will benefit the system, family, and student well-being. Anchoring this planning in the values of collaboration, mutuality, cultural sensitivity, and empowerment enhance the overall climate of the school. Staff members may have experienced uncertainty, stress, or loss due to COVID-19. or racial unrest, and this will affect people differently. A tiered plan for wellness and mental health can support staff adjustment and prepare them to better support students when they return to school. The plan should include wellness strategies designed for all staff, as well as supports targeted to staff who may be experiencing elevated levels of stress or who self-report traumatic experiences. As schools consider how to support staff during this transitional year, it is important to also focus on how the decision-making process has affected administrative staff and plan support for administrators. Practicing self-compassion and utilizing a support system can assist administrators with increasing their emotional and physical capacity to support staff, students, and families. School entities can also support this by ensuring boundaries which provide limits to becoming consumed with the demands of the administrative role and responsibilities and support a work-home balance. Engaging in self-care for administrators by intentionally scheduling check-ins with other administrators to process barriers and celebrate successes can enhance feelings of wellness. Addressing administrative self-care and wellness promotes administrators' ability to support staff, students, and families. This can enhance the systematic self-care, which can include staff check-ins, quiet zones in the building, and intentional practices designed to enhance feelings of safety. Ensuring that we're supporting staff from the top of our educational entity down through everyone who works in our individual buildings supports our ability to engage in self-care practices and supports a systematic self-care model. These provide enhancements to personal self-care and help maintain a feeling of calm, balance, and well-being throughout the school day to support our students and families.
Now we will discuss supporting student wellness. As school entities develop plans for the 2020-21 school year, plans supporting student wellness will be a critical component to promoting feelings of safety and support academic growth. Development of a safe, supportive environment with a focus on relationships is vital to supporting students as they return to school. As we mentioned in the beginning of the webinar, it will be important to create an equitable and safe environment. Enhancement of social and emotional wellness in a virtual environment will be important, and monitoring and tiering at-risk and vulnerable students within a tiered model will be an approach that will be worthwhile. When we consider social and emotional wellness in a virtual environment, we want to highlight that when we think about families and caregivers, we have to recognize that family members, students, and staff have experienced differing levels of stress during the closure due to the pandemic and racial unrest. We also must recognize that students have most likely spent more time on digital devices than prior to the pandemic and at a very young age. We also must recognize that family support in the use of technology ranges from implementing internet safety strategies and encouraging positive digital citizenship to unmonitored use of technology. We also need to consider equitable access, and this includes recognizing that during the school closures and the implementation of continuity of education plans, students have had varying degrees of access to technology. We must recognize that not all students participated in social and emotional activities when they were provided by teachers. For example, class meetings may have provided opportunities to, for example, share feelings, frustrations, concerns, and/or positive stories about their quote-unquote stay-at-home experience. As we consider staff training, it's important to recognize that not all teachers who work diligently to convert in-person classroom learning to remote learning have a background or professional development in social and emotional or trauma-informed practices, as well as internet safety and digital citizenship. A tiered approach to student needs to prioritize staff capacity for prevention, connection, and intervention is important at this time. For each tier, consider what staff support can be planned for and provided. For example, mentoring, student check-ins, family check-ins, SAP referrals. Considerations for tiering include support based on natural supports, for instance, relationships, mentoring, social and emotional programming, and LEA supports. Providing universal supports based on supportive relationships, social and emotional wellness, and emotional, behavioral, and physical safety can assist with reestablishing school routines and reduce stress responses in many students. Considerations for universal practices during school reentry include emphasizing relationship building, reestablishing feelings of physical and emotional safety, and intentional social emotional learning content in the first week. There are a few questions to consider as we unpack this. What teams are already in place in the school setting to assist with tiering of students? Who in the school setting has strong relationships with students at each level, medium level, high level, and urgent need of level? What processes or natural supports are already in place to support students in each tier, medium, high, and urgent levels of need?
As part of this plan, we also want to discuss alignment with supplemental student services. Supplemental student services include services that provide students with additional academic, emotional, social, or learning supports and are provided outside the regular school day. Considerations are provided for coordination with supplemental services provided during the school day through federal programming, in addition to extended day, extended year, and child care services. Coordinating services with all programs a student may be engaged in will increase the feeling of safety and support for students and families. Intentionally thinking about how you can use your district, federally funded program staff, and supplemental student service staff to support some of our most vulnerable students can reduce the demand on district administration and staff and more effectively support your students, families, and communities. For working families, childcare for school-aged children is a critical support. School-aged childcare is provided in varying ways throughout the Commonwealth, and coordinating and communicating decisions regarding your school policy, access and calendar of operations, with childcare operating within the school buildings and outside the school buildings is critical to supporting families of children who cannot be home unsupervised. As we move into the 2020-21 school year, the thought at the forefront of parents, staff, and administrator minds is how we can best support our students in light of the unparalleled events of 2020 and the uncertainty moving forward into the new school year. It is important to realize that the most important thing we can do is create positive, safe, stable, and supportive relationships with our youth. This continues to be the #1 protective factor for youth. A recent study was published regarding positive childhood experiences and adult mental and relational health. This study was unique in that it not only addressed positive childhood experiences, such as relationship building, but it also looked at adverse childhood experience levels and the amount of adverse childhood experiences that had been experienced by the adults. What was found was that positive childhood experiences showed a dose-responsive association with adult mental health and relational health, even when you counted for adverse childhood experiences. What this means for us is that fostering safe, stable, nurturing relationships for children affect outcome later in life, and the more positive childhood experiences a child has, the higher their chances of a positive outcome. The 7 positive childhood experiences identified in the study included they felt able to talk to families about feelings, they felt families stood by them during difficult times, felt safe and protected by adults in the home, had at least 2 non-parent adults who took a genuine interest, felt supported by friends, felt a sense of belonging at the high school, and enjoyed participating in community traditions. While we cannot affect all of these in our educational entities, we can support stable relationships with adults and a sense of belonging in our school system, as well as supporting our families so that they are able to better support our students. By working together and thoughtfully focusing on providing wellness activities that focus on staff, students, families, and communities, we can work to create an equitable, safe environment that promotes overall social emotional skills enabling academic growth. For more information related to creating equitable school systems, a roadmap for educational leaders, please visit the Pennsylvania Department of Education's website at www.education.pa.gov.